Stop scrolling. That burning pain in your stomach may not be just gas. It could be your body's desperate cry for help. Every day, millions of people ignore stomach pain. They swallow another painkiller, skip another meal, or blame stress. But your stomach remembers everything. It keeps silent until one day it cannot anymore. Gastritis is the inflammation of the lining of your stomach. Think of your stomach lining as a protective shield. When that shield becomes damaged, stomach acid starts to irritate the tissue. This leads to pain, discomfort, and sometimes serious health problems. The organ affected is your stomach. It is one of the hardest working organs in your body. It breaks down food, helps absorb nutrients, and prepares your body for energy. When your stomach becomes unhealthy, your whole body suffers. Why does gastritis happen? Your stomach normally protects itself from its own acid. But stress, infections, unhealthy habits, or certain medicines can weaken that protection. Once the shield is damaged, acid attacks the stomach lining. Some people have a higher risk. People who smoke, those who drink alcohol regularly, people under constant stress, anyone who frequently takes painkillers like ibuprofen or aspirin, older adults, people infected with Helicobacter pylori bacteria. Even poor eating habits can increase the risk. The causes are many: a bacterial infection, long-term use of pain-relieving medicines, excessive alcohol, smoking, chronic stress, autoimmune diseases. Sometimes spicy foods do not directly cause gastritis, but they can make existing symptoms worse. The early signs are often ignored: a burning pain in the upper stomach, bloating, nausea, feeling full after eating only a little, indigestion, loss of appetite, frequent burping. If the disease becomes worse, symptoms become more serious: severe stomach pain, repeated vomiting, unexplained weight loss, extreme weakness, dark, black stools, vomiting blood. These are warning signs that should never be ignored. Without treatment, gastritis can lead to stomach ulcers, bleeding inside the stomach, anemia from blood loss. Long-term inflammation may even increase the risk of certain stomach cancers in some people, especially when caused by untreated Helicobacter pylori infection. Doctors diagnose gastritis by listening to your symptoms and examining you. They may recommend blood tests, stool tests, a breath test for Helicobacter pylori, or an upper endoscopy to look directly inside your stomach. Sometimes a small tissue sample is taken for testing. The good news is that gastritis is often treatable.